Good evening, everyone. This is Dr. Palacios, and I'm here to tell you that the pathophysiology video is ready and it'll be started after this little clip. Again, just to remind you, the information presented here is only for educational and informational purposes. It's not intended to diagnose, treat, or replace any type of medical prescription that you or your doctor are going through, and especially in regarding to your heart disease, if happens to be the case. Also, I hope you enjoy the video. It's supposed to be, get the main points of what heart disease is. I try to explain as much as I can in details, and if you need any clarifications, please feel free to, to put your questions. I'll be happy to answer them. All right, until then. Hi everyone, this is Dr. Palacios and I am here to talk to you about heart disease, but specifically something called the pathophysiology. So to break down this word, pathos means disease or abnormal condition, and physiology is the process of how it happens. So from here I'm going to be speaking about the pathophysiology of heart disease, and specifically speaking. So right now I am drawing the heart, and behind the heart right here are the lungs. This is a vessel that goes to the body or tissue, which is, a compound of your cells. And then this vessel goes back to your lungs, to your heart, and the whole process goes all over again. It's a cycle. So from first, oxygen is the main component that goes to the tissue because that's what the tissue needs to work. And then as an exchange of that, the tissue releases carbon dioxide. That way it can go back to the lungs, and then the lungs do the exchange between oxygen and carbon dioxide. I am going over this because this is essential to understand how heart disease happens. Okay, so if you can think about it, say you have 50% of oxygen going into the tissue, and then the tissue can work optimally, then we're good. But if you notice a decrease of percentage going into the tissue of oxygen, then tissue, excuse me, then the tissue starts working less than optimally, and it becomes to fail, and then cells are going to start dying off, and then that's going to eventually lead to worse and worse conditions. Okay, so let me just erase this. We're going to get started on a new. There we go. A new slide. Okay, so from here, what I'm gonna show you is this is the heart, the anatomical heart. If you can remember, that's on your left side. It's the size of a fist. And this is, so I'm gonna make two different pictures of the heart. One is gonna be full, like the whole 3D organ, and then the other one is gonna be cut in two pieces. In halves. So this one is gonna be what they call a cross section, which is the half size of the heart. And then this is the full picture, or the 3D aspect of the heart. So the cross section, you're gonna have a vein called the vena cava going to the chamber, another chamber, and then here's a third, and then a fourth chamber. Okay, so not to overcomplicate things, just remember that the blood goes from chamber to chamber, and eventually the heart, because of its muscle strength, can pump that blood into a pressure into the whole body. Okay, so keep that in mind. That blood It's what's gonna feed the rest of the body with oxygen. Now the full picture of the heart. This is the whole thing again, except that here is gonna be the main vessel right here. It's called the aorta, and the aorta also has little branches where the blood goes to the outside of the heart in these other vessels, and it's eventually going to feed the heart organ itself. So here you're feeding the heart organ. Now the one thing that happens with people who are overweight or even obese is the following. They actually start accumulating fat layers and fat layers around the heart. The heart has a great ability to hold a lot of fat. If you have ever seen an open heart surgery, you will notice, especially from someone who is obese, that it's very difficult to find like the vessels of the heart because they're covered in fat. So obviously that's going to be a big problem, because if they had a heart attack, they have to find which artery had the failure in, which artery was blocked. Okay, so let's talk about this part specifically to explain what heart happens, specifically something called atherosclerosis. So if you remember, you have the oxygen right here in something called red blood cells. The red blood cells are like this little concave shape. And then you have right here is the vessel, the capillaries. Here's the wall. And this will be the tissue, or over here. And this is the inside of the vessel. Okay? So every red blood cell carries oxygen and then delivers it to the tissue, and then the tissue exchanges back for carbon dioxide. So then the red blood cells can go back to the lungs, and then they exchange oxygen again. So that's the basics to understand. So again, we're going to make a bigger picture here. Again, here's the vessel. And then right here at the wall of the vessel, you have these cells called endothelium. That's a U, endothelium. And these cells are the ones that protect the walls of the arteries from keeping damage. So if a cell here is damaged or dies, then this cell can replicate, or in other words, duplicates, create another one and replace this dead cell. However, when there is enough inflammation and consistent inflammation for many, I will say, months to years, the ability to replicate and it slows down. The ability to replicate the cells becomes slower and slower, because basically you're aging these vessels a lot faster. So what happens is, here the X's are for the dead cells, and again here's the here. And what's going to happen here is this yellow is showing the amount of fat that's becoming involved here. There is a lot of things going on. This is called an atheroma, and it's filled with LDL cholesterol, especially oxidized, which is damaging to the tissue itself. There's also white blood cells, WBC is the abbreviation, and a lot of other things that just keep, and then more fat on top of it, and more fat, and then keeps piling up. So this little thing is called an atheroma. Oma means growth. And athero coming from atherosclerosis, meaning narrowing of the vessel because of a growth. So you see what can happen with that. So say you have 4 red blood cells with oxygen going into the tissue, and in this case we're talking about the heart. So this is called the myocyte, the heart tissue. When this fat just keeps increasing in size, and I'm going to show you on the slide again, the vessel, here's the myocyte, again myocyte meaning myo for cell, muscle, and cyte for cell. So cardiac myocyte, because of they belong to the heart. And then here we have our atheroma, which leads to the atherosclerosis component. So again, we have our red blood cells here, and then the myocytes are happily receiving here in this area. Say they're getting 100% of oxygen. But then after this, you notice that less and less red blood cells are going to get through because of this obstruction. And then, some of them can get stuck in here and can cause even more damage and more damage. And here, say now, the percentage of oxygen is going to decrease to 50%. Again, these are numbers that I'm making up. This is not in itself clinically relevant. I'm just showing a number to kind of portray what's really going on with this. Okay, so now for the next part, say finally the atheroma gets so big that not even a red blood cell can get through. So here now there is no oxygen, or say less than 50%. Now these cells will start dying. And then when a cardiac cell dies, and here I'm actually drawing a heart cell. So here's 1, 2, 3. And the thing is that this heart cells kind of work together. So if this contracts, if this moves, then this one moves, and then this one moves, and then so on. However, if say number 2 dies, 1 will move, but then 3 will not get the message, and it will not move, and eventually that's gonna cause basically something like an arrhythmia, which means the nerves are not connecting with the heart cells. There is disconnect between the cells, and eventually all that, as you're seeing, the heart tissue itself so again, this is the heart. Now I'm gonna put as gray the areas where there is atheromas and obstructing. So say this whole area gives the whole oxygen to this part of the heart. Now if this part of the heart is not pumping, then the heart is gonna weaken, and it's eventually gonna start failing, and that's what leads to heart failure. Because this side is not working, whereas the rest of the heart is still working, but there is no synchronicity, and that is very important for the heart. So synchronicity in movement, in pumping, because if you ever listen to your heart, you'll notice that it makes a sound. Lub dub, lub dub, lub dub, lub dub. If that sound changes, it means that your heart is going through different pumping system, and that's usually not a good thing. Okay, so again, synchronicity means syn for not ideal. It was same, and then chronicity from chronos, meaning time, so at the same time or the same consistency. So once you start having this heart failure over here, this is where the heart starts eventually going through phases of less pumping, less force because the muscles are dead. You know, the cardiac cells are also muscles. And then eventually hypertension or high blood pressure is developed because that's a way to compensate for the heart. Because what happens is the kidneys start receiving the messages, and that's another thing that I have to put here. So kidney damage or kidney demands. Because when the heart is pumping and the kidneys are not receiving enough oxygen, the kidneys are going to send messages to the bone, and then hormones, and then other messages to the heart to tell, all right, you gotta step it up. We need the oxygen here. So what happens as the heart receives that message is going to eventually increase the pressure. So it's going to end up becoming a type of chronic high blood pressure as a way to compensate. However, that high blood pressure will help pump more blood to the rest of the body, but it's only for a little bit until the heart starts failing even more. And that eventually can lead to something called cardiomegaly. So cardio for heart and megaly for giant. So a giant heart or a bigger heart. So now the heart is going to be bigger than your fist, but it doesn't mean that it's going to be stronger. In fact, it's going to get weaker, and the walls are weaker, and you'll notice that the chambers are going to be even bigger than it used to be. And that eventually is what's going to lead to heart failure and eventually leading to a heart transplant, or put in the list for heart transplant. Okay, so we did go over a lot of stuff. And what I want to say is that just keep this in mind. There is a lot more information than this, but this is just the very basic of what the pathophysiology is of heart disease. Okay? So I hope this helped at least give some insight into what heart disease is. Again, it's a very in-depth process of how heart disease happens, because there are many other factors that can lead to this. It's not just this leads to this, this to this to this, and it's not a step-by-step process. It is a lot more complicated, and it is important to know though which one is leading to which one. Okay, so thank you so much. I hope this helped, and if you need any more clarifications, feel free to ask your questions. I'll be very happy to answer anything. Okay? All right, thank you so much, and have a nice time, and tomorrow we'll keep going with the next video.